Hello, everybody. Welcome, welcome. Just getting everything set up. Everything's ready to go. Thanks you guys so much for joining us today. I know we're really quick on time, so I'm going to go ahead and get started and let's talk about what's going on today in our community forum. And here we go. All right. Well, like I said, welcome everybody. Today's agenda is going to be different from our first community forum. So if you weren't able to attend that one and today's your first one, you can check it out. It is in our YouTube channel. So you can access that if you want to see that one. We did a CHR demo. We talked about the Reg portal. And so some of the thing, and then the other services that HHIE offers, like data routing, and one of the tools we have is Notify. So today's agenda, we're going to be showing you Notify. If you've never seen that before, then this will be an interesting thing to see, a different tool than the community health record. Jackie's going to take it over at that point and do an evidence-based practice review. There's a new article that came out from Contexture regarding HIEs and their where we are and kind of some really cool information about us. And then I'm going to take it back over to do a Keiki Health Insights project. So we've been working with Hawaii Community Foundation on this, and really excited to show you kind of what we found with that one and what we've done for that project. And then we'll close out with some Q&A and see if anybody has any questions, and then in the session. So first off, my name's Clarissa. I am the Director of Provider Services with HHIE. I've been here since February. If you've seen me before, it's most likely either in a community health record or Notify training. That is my where I lead HHIE. So I am the lead trainer for those two tools. I also, if you've seen me before, is probably at a conference. We do attend conferences throughout the islands as well as in-person training. So if anybody's interested in setting up a training session, please reach out. My background is as an APRN, so I've been a family nurse practitioner for 7 years. I've worked in family practice and pediatrics, and as an RN, I've actually worked in med-surg and ER. So I bring that clinical focus forward for our IT training platforms. So that way, I get to know who my users are. I ask at the very beginning of our calls, what's your role with your organization, so that I can tailor the training session directly to you, what works for you. And I try to not waste your time, because I know time is precious in healthcare. So excited to meet anyone new, or well, I see a couple familiar faces, or at least names here today. And I'll turn it over to Jackie.
Hi, everybody. I'm Jackie. You probably don't see me. I don't conduct as many trainings as Clarissa does. I am the client relations specialist here. And a lot of what I do is on the back end of things, getting people access to the CHR system, or resetting passwords, that kind of thing, and just kind of trying to streamline the user experience. I too am a clinician. I spent 10 years as a speech language pathologist within the acute care geriatric world. And about 7 of those years was actually here on island in a couple of the hospitals. So pretty excited. I've been with HHIE since July, and we've been hitting the ground running, and we're going to talk about some of the stuff that we're working on today. So I'll turn it back to Clarissa so we can get the show on the road.
So happy to have Jackie. It's been such a breath of fresh air, and really bringing that force together of ideas and really collaborating. I mean, definitely, without her, I don't think I could have brought these back as quickly as we did. So excited. Now let's go on to the Notify demo. I did provide the link here. If anyone, we will have this in the meeting invite after the session's over. So if anyone is interested in at least seeing what that tool looks like, this is the login if you do have it for your organization. But today I'm actually going to be demoing this from our CERT environment. So I can actually show you what the portal looks like. This is not real patients. So this is not real data. This is just our test environment. It looks like we were testing some Maui Health System in the CERT environment. So we have some test patients to look at. This is our Notify portal. So it is its own unique login. It is a separate subscription service. You have the CHR, and then you have Notify. Notify does work in combination with the community health record, because you are able to, once you see the notification, it does have a single sign-on bridge to see those records. And I'll show you how that works. So if you have Notify, or if you're interested in Notify, basically what you do is you provide us a roster. And that roster is a list of your patients. And we usually have name, first and last name, gender, and date of birth. And we put that into our database here. And then anytime that patient is seen at a facility that shares data or ADT data with HHIE, we are able to alert you when that event takes place. And so you can see here that we have different event types that you can be notified on. We have different ambulatory admits. So if you want to know every time your patient goes to see a specialist or goes to get their labs drawn, you can get notified on those. Emergency admissions, emergency discharge, inpatient admissions, if you want to know if your patient gets admitted to the hospital or even discharged from the hospital so that you can get them back into the clinic sooner. If you want to know if your patient's transferred, this happens a lot on our outer islands, right? So they end up getting transferred from one facility to Oahu for care. And then patient death notifications as well. So you can customize this. So if you say, you know what, I really just need to know if my patients or when my patients are admitted to the hospital and when they're discharged, then I can definitely set up that subscription for you to only alert you on those types of encounters. If you say, you know what, I want everything, I can turn that on too. And if you say, even in this instance, if you say, I just want to, this particular cohort of my patients, I want to know everything, but this particular cohort, I really only need to know if they go to the ER, then I can set 2 separate subscriptions up and you would see them here. So you'd be able to see those different subscriptions there so that you could see those alerts. This is really a customizable workflow, and this is the portal. But you can actually receive it if you're one of those people who want to know real time, right? You want to know the moment it happens, because if you want to use the portal, then you just, come incorporate it into your workflow, either 5 minutes in the morning, 5 minutes in the evening, whatever that is, you come in, log in, see your notifications. But if you want to know right then and there what took place, we have a couple other avenues you can explore. You can do PHI included direct secure messaging. So if you have direct secure messaging with your EHR, or HHIE does offer direct secure messaging with our community health record, you can sign up to get those alerts through there. And that does contain PHI information. If you just want the alert and you'll log in and see what actually took place, we do have SMS text. So if you want to receive a text message alert, or an email, just a regular email that comes through to let you know that an event has taken place, we do that, and it doesn't include PHI. So what that would do is just allow you to say, oh, I know it happened. So then you log in and you can see that event that took place. If you incorporate it into your workflow, you can set these customizable ranges. So you can see I did it for a certain time period, and you can see all of those events that have taken place during that time. And it's real-time data. We usually try to strive for a 10-minute notification. So from the time the event takes place to the time that you receive the alert, we usually strive for 10 minutes. And so you can see here that I'm just going to pick one just out of we'll just go to the top one. So we see here the event took place on November 24th at 11:40. You were notified on November 24th at 11:43. This is our fake test patient. And then we can see where that patient was seen at for that event. And we see it was an inpatient admit. So I can click into that alert. It will then bring me into the alert notification. And it's basically the same information as we saw before. But if you go to the second tab, which has event data, you can see it's basically like your face sheet, right? So if you're familiar with the community health record, it's basically like your face sheet, and you can see what that event was for. And then it has this little button here that says view patient detail. And you can see it says click to view patient details from the CHR. So we are able to do a single sign-on. They do work in tandem, as I mentioned. They do work together. So you can not only be alerted for the event taking place, you actually get the details of what took place during that. So you click this button, and it doesn't work because it is a test patient. So I'm going to go back to my PowerPoint here. And it will automatically bring you over to the community health record. And it will go ahead and log you in, search for your patient up here. And so all you have to do as a user is select your provider and your reason. If you're a provider, you only select your reason, and you access additional records. Once you do those options, it will then bring you into the community health record, into that patient's chart. And you just have to know where to go, right? So it's Maui Health Systems. So to bring in Maui Health System data, we go to Documents tab, we go to the Find External Documents, we query those in, and now we've got our Maui Health System data to bring in that we can see what happened. So it was an inpatient admit, so we can see what's going on from the ER until the admit status and see where our patient is. So the Notify tool is an additional cost associated with it. For most of our practices, for community health record portal alone, it's $300 for one provider and up to 2 staff per year. And then for both, if you want Notify with the deep link to the CHR, then it's $600 a year for one provider and up to 2 staff. And so this tool, I love that they work together. I love that it really puts the being able to pull the patient back in after a visit helps reduce that ER readmission rate, inpatient readmission rate, and allows the provider to be in control of their patient care. So really excited about that tool. And I do lead the training on that one as well. I'll turn it over to Jackie. She's going to talk to us about the evidence-based practice article.
Awesome. Thank you, Clarissa. So I went ahead and put this article in the chat if anybody is interested in reading it. You can go on to the next slide. And so this article was essentially written because they wanted to see how health information exchanges, or HIEs, impact healthcare, as most of the studies that are done more through a survey format. So they recognize that HIEs can be cumbersome, but they wanted to see if using it actually had a quantifiable impact. So they asked a couple of different questions, or what they were trying to figure out is, what is that impact of providers that subscribe to HIE services on patient emergency room visits and inpatient admissions compared to a control? 2, does the type of provider adopted HIE service influence the effects of HIE subscription on patient utilization? And 3, does the patient insurance payer type influence the impact of HIE subscription on patient utilization of emergency room and inpatient facilities? So what they did is they reviewed claims data for 15 months before and after an enrollment period between the years of 2017 and 2019, as the clinics onboarded to the HI solution that they were going to be using. There was 3 different groups. There was one that had an integrated EHR that had the HIE integrated into it. There was one that only had access to the HIE through a portal, and then there was a control group that didn't have either. So then they looked at patients that only had one medical claim, and they included them in their studies. And then they calculated a per member per year rate to adjust for partial year coverage. And they used SQL and SAS to compare the pre and post enrollment changes, and conducted statistical analysis to kind of come to their conclusions. So if you can move forward, please. So what they found is that when you increase the provider subscriptions, it shows a strong perceived value, but the quantifiable actual evidence is still limited. And this study was unique because it included all ER visits and hospitalizations, not just readmissions or ambulatory sensitive conditions. They found that providers that used HIE portals and EHR integrations saw decreases in inpatient admissions, with the greatest number of reductions were those who had the EHR and the portal integrated into one, which is kind of intuitive because you're thinking, when you're using your workflow, if you have less clicks to get to another screen, you're going to be more likely to incorporate that service into your workflow. So those people that had that external portal, it might just, that extra step may be the difference in utilization. The ER visit reduction statistically wasn't significant, but there was a difference between the control versus the portal only, and the integrated EHR HIE had the least amount of admissions or ER visits in comparison to the other 2 groups. And then they did find that Medicaid patients were the ones that benefited the most from the HIE being a part of the workflow, and which is suggestive that this is reducing administrative burden and really improving the access to care, and just kind of supporting the need for interoperability across systems. When we're looking at a value-based care model, it is helpful to think about, is HIE is HIE reducing those administrative burdens for our providers and enabling them to get better access to care or give the patients better access to care. Um, so there were some limitations with this study. The pre and post design could also be reflective of external factors, could be aging population and global trends. The years that the study was conducted was between 2017 and 2019, and that was pre-COVID. And the landscape of healthcare has changed a lot since then. So there's probably some more research that needs to be done post-COVID to see what kind of impact it would have, but it still does highlight the importance of that interoperability and HIEs in general. And then lastly, the provider engagement level wasn't verified during this study. So essentially, in conclusion, you know, there has to be more research on these things now that we have, um, we're identifying that there could potentially be a cost benefit to investing in HIEs, but, quantifiably, there's more that needs to be done to kind of show that value. And, you know, healthcare costs are rising. So being able to have HIE products integrated into EHR solutions can reduce those ER costs, and especially for those, Medicaid patients. And improving outcomes overall should always be the goal. And we actually are working on a project of our own, and now I'm going to pass it back to Clarissa so she can talk a little bit about what she's been working on, not related to HIE integration, but just on what HHIE has been doing.
Oh,
Clarissa, you're
somehow
muted.
I got muted. I got it. I fixed it. But I highly recommend everyone to take a look at the article. I think it's a wonderful article. It was really well researched and really shows that there's a lot more research we could do on the HIE space. All right, let's get this going. Here we go. So the Keiki Health Insights Project. So this one was my first project, my big project working with HHIE. We actually we got a grant from Hawaii Community Foundation to do this. And so what we did was we had three main initiatives, and I'm going to try to speed it up because I know we're getting close on time. But we had three main initiatives on this. We wanted to enhance the amount of pediatric data we see in HHIE's community health record. So we actually onboarded 5 pediatricians who shared data with us, and they're still sharing data with us. And we did it through 2 different types of EHRs. So we did HPH Epic as well as Elation. And so those 5 pediatricians, we were able to get that data into the CHR so that we can look at it in 2 different ways. We looked at structured data and unstructured data, and I'll go into those in just a few minutes. The second was improving data quality. So we use Quanta Health, which is a healthcare data quality platform that helps organizations clean, standardize, and improve the reliability of clinical and claims data. So it makes data more useful for the purposes we're looking to improve, right? Research, better patient care, innovation for new opportunities. And what they do is they use the US Core Data for Interoperability, or the USCDI. It's a nationally recognized standard that defines the essential healthcare data elements, such as demographics, medications, allergies, clinical notes, that have to be consistently exchanged across a system to say that it's interoperable nationwide. And so we use them to evaluate our data that we have, and then they're providing us with dashboards, and we're going to be able to present those to our data sharing partners so that we can improve the interoperability throughout Hawaii. And then the third was increasing immunization data, right? So you may see some immunizations being populated within your clinical notes if you're looking at those, but we want to make a direct connection with the Department of Health's ISIS system. And so again, going back to the evidence-based practice, reducing the clicks, right? If a provider can come in and look for an ER note, inside the patient's community health record portal, and also have access to their immunization record within one database, it reduces the burden of having to log into yet another portal to access that. And so those 3 initiatives were our main focus for the Keiki Health Insights project. And so really excited to keep moving those things forward. And so what I wanted to talk about mainly with the data, so my part was mostly in initiative 1, where I was the most involved in the care. And so we looked at structured and unstructured data. So kind of giving you some background about what that means from a data perspective. So structured data, think of it like a template or something you're easy to extract from a note, right? It's quantifiable data, meaning how many times did they use this ICD-10 code or this Z code, or, you know, a questionnaire, yes or no answers, something that's easy to pull that statistics out of. And that's very easy to do in a data analysis realm. What's harder to do is an unstructured data analysis. It's very manual, and I treat it like qualitative data. I had to go, we did 5 pediatricians, as I mentioned. And what I basically did was with those 5 pediatricians, I set up a time frame and said I wanted charts from those pediatricians. And I basically just went in from a clinical mind and just reviewed about 20% of each provider's charts and pulled out some of these cool things. And this is kind of the word cloud that kind of got pulled from that manual unstructured data review. And so looking at social determinants of health has been a really key focus with the Keiki Health Insights, because it's tied into the Promising Minds project that they did. And so they're really trying to increase the knowledge of reimbursable Z codes that providers can use to help capture some of that frustration, or at least those challenges that families are facing. And I think that really speaks to education from a provider perspective, because providers, we're not coders, right? We're not excellent at that. We're really good about having those meaningful conversations, but we're not always good about knowing that, hey, did you know that, you know, I can see it in your note that there was challenges with these SDOH type issues, but they're not coded in your, you know, assessment and plan. And it's because we don't know that those are available. And so I'm really excited to present. I'm actually going to be presenting in January at the Echo Series, the Pediatric Echo Series with the pediatricians. I should have more information on that when we do our next session in January. So if anyone's interested in attending, that will be more of an educational session specifically about these SDOH and reimbursable Z codes. So happy to have people come on board for that. I think we're doing pretty good. We did pretty good on time. I'm happy. We're doing good. We're into the Q&A part of it. As always, happy to answer any questions related to what we just discussed, as well as any general questions you may have about HHIE. And I'll turn the floor over. Jackie, was there anything in the comments?
No, not yet, but now the floor is open. So if anybody does have any questions, feel free to add them in the chat or in the Q&A section, and we'll be happy to see what we can do to get you answers.
I'll kind of talk here for a second, just say, you know, the tool, you know, Notify, we talked about Notify. If you're interested in that tool or interested in learning more about Notify, you can reach out to myself or Dr. Burton, and we'll happy to kind of give you some more information about it. And then, as always, if you want to schedule a training session on the community health record or Notify, if you have that platform with your users, reach out to me and I'm happy to do that. If you need assistance with adding or removing users or password resets for your users, reach out to Jackie. She'll be able to help you get going there.
Yeah. Also, to moving forward, if anybody has anything in the future that they want us to discuss or touch on, or there's something that we offer that you just would like us to expand on, you can feel free to also put that in the questions and comments, and we can try to incorporate that into our next community forum as well.
Yeah, I think that's really cool. You know, we're definitely trying to make these unique. Each one is not the same. So that way, you know, as you attend, you learn something new and maybe get some more information about HHIE and our involvement with the community. And so really excited if anyone has any ideas, or maybe you want to help, maybe you want to come and be a presenter at our community forum. We would enjoy that too, taking a break from it. So and we can engage with you guys to come in and present and offer any guidance there. We'll be happy to do that.
We do have one question, just clarify, Notify tool is 600 per year per provider. It's 600 per year per one provider and up to 2 staff.
Yeah, so if you have more providers, then it would just go up. Yeah.
Yep, and that includes that deep link to the CHR. So you wouldn't need 2 separate subscriptions. You could just have the one and it would get you access to both.
Right. Well,
All
we're
right.
ending with 5 minutes left, so we'll go ahead and we'll hang out here in case anyone has any lingering questions. But thank you guys so much for joining. Hope you learned something new, and we'll be back for our next session in the new year. Excited to say that.
Yeah.
All right. Thank you,
December,
everybody.
December doesn't feel real. It's too fast.
I know.
All right. Thank you, everybody. I think that's all.
Oh, Ton's so sweet.
Mhm. The portal that my staff has, if we subscribe to the tool, will that be added to your current portal? Are you talking about Notify? Because the um
Jenny, right? Is it Jenny who asked that question? I
I
can
think
turn on.
that
Can we
was
turn on her?
can I think that was Candido, but it looks like he's gone. Yeah, Jenny. I think she should be able to unmute herself.
Oh, sorry, it was disabled. Hi,
Hi.
I just have a quick question about the direct messaging. Is that like who can you direct message? Is that part of the Notify subscription? I just a little bit more details about that.
Yeah, so direct secure messaging is through our community health record. So if you have access to the community health record, we can always turn on your DSM, and we set up a unique email address for that DSM. And then what you do is you create a folder inside your whatever email you use. And so all those alerts that you get through DSM will actually go in there. Do you already have
Oh.
community health record access?
Yes, I do, but I didn't know anything about direct messaging. So
Yeah.
who would you be able to message? Like
So,
providers at
well,
Queens or who?
yeah, we used to use it a lot more for referrals because we used to have a referral platform inside the community health record. And
Oh,
so that used to be the way to do the referral system was through DSM. But now it's mainly just used for, we don't have a whole lot of users who are using it. Usually it's only
okay.
those who want DSM through email, like through Notify.
Okay,
Or
okay.
they just like it for their own personal, and you can email, but you can email anyone within the network that also has a DSM through there. And that one is a secured email, so you can send PHI through it.
Okay, but it's not commonly used for if I need to ask questions or do like transitions of care communication with providers for patients in
Yeah,
hospitals. Oh,
we're trying
okay,
to
okay.
bring it back. We actually are hoping to expand it when we upgrade our platform to bring it back to allow us to do some closed loop referral systems through it. It's in the works, but nothing concrete. So I would say too, there's no way of knowing read receipt, right? There's no way of knowing whether or not that user got it and has looked at it. So I
Okay,
wouldn't
got
use
it.
it for that general
Okay,
use.
that would be extremely helpful because
Yeah, I know.
a lot of the times, like for our caseload, it's so difficult to get in touch with hospital case managers or providers and that sort of thing. So it would be really, really useful if it was used for that, for PHI and transitions of care and all of that. So, okay, thank you for answering my question.
Yeah, no worries. And let me touch base. I do have a couple users who do use it for that type of situation. Let me get with those users just to get their direct workflow. So maybe I can provide some better insight, and I'll reach out to you directly, Jenny.
Okay, all right, thank you. All right,
You're
ladies, have a good
welcome.
day. Okay,
You
bye.
too. Bye.
Thank you. All right, ending the event.